You may proceed when ready.
Thank you, Mr. Chair and members. I'm pleased today to present AB 624, which will require schools that choose to issue student ID cards to include on those cards phone numbers for sexual assault, domestic violence, and reproductive health hotlines. This legislation builds on SB 972, which will soon require student ID cards in California to include the number for the National Suicide Prevention Lifeline. The purpose of this legislation is to ensure that young people, especially those facing a challenging situation involving domestic violence, sexual assault, or sexual health, are able to access timely and accurate information that may be essential to their physical or mental well-being. Unfortunately, there is a real and urgent need for young people to have access to this information. Statistics demonstrate that 1 in 3 teens will experience teen dating violence, 1 in 9 girls will experience sexual assault or abuse before age 18, and STI rates continue to rise among California's teens and young adults. In short, it is vitally important that our students have access to resources including information, support, counseling, and treatment regarding sexual assault, domestic violence, and reproductive health. AB 624 would make this information more easily accessible, especially for those whose internet usage may be monitored by an abuser. Unfortunately, one of my witnesses had to leave, but with me to testify in support is Leandra Clark Harvey, PhD, with the California Council of Community Behavioral Health Agencies. Thank you, and I respectfully request your aye vote.
Good evening. I'm Leandra Clark Harvey from CBHA. We represent the nonprofit community behavioral health organizations that provide mental health and substance use disorder services across the state. Unfortunately, California students are victims of sexual assault, domestic violence, and do not always have appropriate information about reproductive health. The effects of sexual assault and domestic violence can be long-lasting and can affect a student's mental health. Unfortunately, students don't always have the ability to readily access information and resources that can help them cope with these issues. So we're supportive of the efforts to provide students with greater access to resources that promote better mental health, and we urge your support of this measure. Thank you.
Thank you. Others in support?
Good evening, LeAngela Reed on behalf of the Western Association for College Admission Counseling in support.
Sherry Coburn for the California School Nurses Organization in support.
Great, thank you. Any opposition? And I do want to note that you did accept the amendments.
Yes, thank you.
And the amendments remove that private schools serving students in grades 7 through 12 print a sexual or reproductive health hotline on student ID. So I know that I see an opposition letter up here, and I think you addressed that on the private school side, the religious school side. You may proceed when ready.
Thank you very much. Mr. Chairman, members of the committee, my name is Ray Burnell, and I serve as the Education Director for the California Catholic Conference. As the official public policy voice of the Catholic Church in our state, we are opposed to AB 624. Our opposition to this bill is because the mandated inclusion of multiple hotline numbers, regardless how worthy, would diminish the efficacy of the only number now required on student identification cards, the National Suicide Prevention Hotline. Adolescent suicide and self-inflicted injury is an unparalleled national crisis. Deaths from suicide among children younger than 17 years old grew 84% in the last decade and increased by 231% for girls aged 10 to 14. Suicide is the third leading cause of death for children aged 10 to 14 and the second leading cause of death for those aged 15 to 24. Nearly 1 in 5 California high school students seriously consider attempting suicide. 9% have attempted suicide 1 or more times. Every life is precious and must be protected, especially when most weak and vulnerable. Requiring only the National Suicide Prevention Hotline on IDs help prevent imminent death among our youth who are at risk of killing themselves. That's why this single number was required on students' IDs with the unanimous approval of the California legislature and with universal support among our state's public and private school communities. This number gives students contemplating suicide and other students who know classmates that may be doing so a dedicated resource to immediately access vital supports necessary to challenge and cherish their life. We should not distract from this resource, as AB 624 would do, and we ask for your no vote.
So can I ask you, what are you asking for? What do you want and not want in this bill? I'm confused.
We're opposed to the bill.
I know that, but what are you opposed to in the bill?
The addition of any numbers in addition to the National Suicide Hotline.
Okay, so you don't want the sexual assault hotline added and the local domestic violence hotline added, correct?
Correct.
Okay, understood. Sorry, I want to make sure that I
Yes,
understand.
that is correct.
Okay, thank you. Next witness.
My name is Matt Sharp. I'm an attorney with Alliance Defending Freedom. Over 40 years ago, the Supreme Court struck down a New Hampshire law that required its citizens to display the state motto on license plate, holding that an individual has a First Amendment right not to be a courier of the state's message. And just last year, the Supreme Court struck down a California law that required pro-life pregnancy centers to post contact information for abortion referrals. AB 624 suffers these same constitutional flaws because it compels religious schools, students, and staff to use ID badges that communicate messages they may find objectionable. Under the bill, a private college that endorses a pro-life ideology would be required to design, print, and distribute student ID cards that include the telephone number for a sexual or reproductive health hotline. Using threat of losing state student financial aid, the private institution must surrender its voice in order to promote the state's preferred ideology. Yet the harms of AB 624 are not limited to private institutions. Students at both private and public schools are likewise forced to become carriers of the state's ideology on issues of sexual and reproductive health. Students publicly use their IDs to check in at school, purchase lunches, and gain access to school events. Some schools even require students to wear their IDs as a safety precaution. But under AB 624, a teenage girl who starts a pro-life club at her school would be required to daily carry, use, and even wear a telephone number for Planned Parenthood. And this compelled speech requirement cuts both ways, as some pro-choice students may object if their school chose to use a local pro-life pregnancy center as the hotline to publish on student IDs. This law will inevitably lead to costly litigation against school districts that they will almost inevitably lose. Requiring students to be messengers on behalf of a government ideology opens a Pandora's box because any message forced on students by the government is going to be controversial to some. If the state wants to promote a hotline, it has innumerable ways to do so. Billboards, ad campaigns, flyers, but what it cannot do is force private parties to speak its message on its behalf. Thank you.
Thank you. Very well done, and within 2 minutes. With that, others in opposition.
Yes, Philip Escamilla, William Jessup University, and we are opposed. Thank you.
Great, thank you. I just want to note that there are two sides to this bill. There's the 712 portion, and there's the higher education portion, which is going to be discussed in the higher ed committee. We're not going to address that today. With that, I'm going to, there's
a couple more
further
here.
opposition. I'm sorry.
Yeah. Greg Burt, California Family Council, in opposition. Thank you.
Jonathan Keller on behalf of the California Southern Baptist Convention, opposed.
Thank you. With that, any comments from any of the committee members? Ms. Caller or Mr. Kiley?
Good evening, Mr. Gabriel. So I understand that the private schools, 7th through 12th grade, have been taken out of the bill, but the private colleges are still in there. So is there a plan to address that?
You know what? That is going to be discussed in the higher education committee. Says this is not the committee for that. We're not going to discuss the higher ed provisions because that's going to be in the next committe. So
well, we are voting on the bill today, so I just wanted to get Mr.
My
Gabriel's
suggestion is that you
issue.
vote no.
Well, if I
If
wanted
you don't
your
like the bill,
suggestion, I'd ask, but thank you.
But again, hold on. This is the purview of this committee is K-12.
Well, I'll leave it up to Mr. Gabriel.
Let me finish.
I
Listen, I'm the chair. I'm going to speak. The purview of this committee is K-12. Okay? The purview of the higher education, the higher ed committee is higher education. So that's where they're going to address those policy concepts. I'm sure you have concerns. You could express them to the author individually outside of this hearing, but I don't want to get into that debate today because we're not addressing that portion of the bill today. We're discussing the K-12 portions, and he has made significant amendments to the K-12 portion.
Did you want to address that, or I'm happy to move on if you don't?
Since we both sit on the higher education committee, I'm happy to talk about it then and with you offline, and I'll defer to the chair here.
Listen, we're not going to amend any part of the bill that speaks to higher education provisions because that is the purview of the higher education committee. So there's no need to discuss them here today.
Agreed. Thank you.
I have a couple more questions. So there's a case that's been mentioned. I think it was mentioned in the testimony, and it's in some of the materials related to this bill. National Institute of Family and Life Advocates v. Becerra. Supreme Court decision struck down previous California statute that required crisis pregnancy centers to post notices regarding where to obtain access to abortion. Struck down on First Amendment grounds. Court said by compelling individuals to speak a particular message, such notices alter the content of their speech. This is compelled speech. So do you think that this particular bill is constitutional under that decision, or how would you distinguish it?
Yeah, absolutely. I think it falls squarely outside of the NIFLA decision. So there's a couple of things going on here that are important to note. First of all, there's no compelled speech issue here because there's no requirement in California to issue ID cards. So that alone obviates the issue. The second part of this is we actually had a conversation with a number of distinguished constitutional law experts, including Leah Littman, who was a clerk to former Justice Anthony Kennedy, is now a professor at UC Irvine, also the dean of UC Berkeley Law School, Erwin Chemerinsky. Both of them opined on the constitutionality of the bill. They think that there's very, very clear distinctions between what was going on in NIFLA and here, where we're simply asking for a number to be printed on the back of the ID card. So we are very, very confident of this bill's constitutionality.
Okay, so I guess the way I might take some issue with that is if the school is requiring the student to wear the ID, and then there's speech on the ID that runs against a core belief of the student, do you think that raises First Amendment concerns?
No, I mean, we require young people to do things all the time, right? And there's we see examples of compelled speech all the time. I mean, your license plate is compelled speech. The labels on a wine bottle or a beer bottle are compelled speech. So there's a lot of examples of compelled speech that's constitutionally permissible. It's not that any compelled speech is impermissible. It's just does it fall? Which side of the line does it fall on? And I think putting a phone number, which a phone number alone onto the back of ID card clearly falls on the constitutional side of that line.
Got it. So when it's the type of compelled speech, I guess I didn't hear how you distinguished the previous statute on that basis.
I'm sorry, I don't fully follow.
So on the basis of the type of speech at issue, it seems like it's a pretty similar type of speech at issue here as with what was called the FACT Act.
No, I mean, the facts in those cases could not be more different. I'd encourage you to go back and read the NIFLA decision. You'll get a little bit of a flavor of that. Here, this is simply requiring simple factual information. It's not requiring, in the FACT Act, as I recall, the compelled speech at issue required somebody to actually communicate a message. Here it is simple, a factual piece of information, a 1-800 number. There's no ideology there. It's a simple, factual piece of information. So it's very, very different than the facts and circumstances of NIFLA.
Okay, what do you make of this concern that was also raised by one of the witnesses that we're going to be limiting the efficacy of the suicide prevention hotline? I mean, this is a bill from Senator Portantino last year. You heard some statistics. I mean, it's an issue I've been working on quite a bit. We've had this rise in youth suicides. It's really tragic. And I think there's empirical evidence that shows when you kind of have a jumble of information, even if some of it's good information that you're adding, you reduce the salience of the information that's there. So how would you respond to that?
Yeah, and I just want to thank the opposition. We had a very, very respectful and appropriate conversation, and I appreciate them coming in and raising concerns in the manner that they did. I think we just respectfully disagree on this point. We're confident that with 4 numbers, young people can find the number that they need. I don't think that that's going to overwhelm or confuse anybody. And we had a conversation. Perhaps it would be appropriate to put that item in red or bolded or do something else to call out the suicide lifeline. But we have a lot of confidence in young people and their ability to find the line that they need.
Thank you.
Let me ask
Are you
I
done?
wanted to ask
All right.
a question. What
Go ahead.
remains now? I'm looking at the amendments, and so much has been taken out. So what remains at this point that you're advocating for?
Thank you, Dr. Roberts. So what we took out was the application of the bill to K through 12 religious schools.
Okay.
I'm sorry, 7 through 12 religious schools.
Okay.
So it applies still to 7 through 12 public, and then higher ed, both private and public.
But it also says you're removing the authorization for the domestic hotline and the sexual assault lines.
So what we had in the bill, we wanted to give flexibility. If folks would rather say than have the national hotline, you wanted to print a local hotline. Okay. We've removed that for 7 through 12. But it would give, for example, if San Diego State wanted to have a campus sexual assault hotline rather than the national hotline, it would still give San Diego State the ability to do that. So we preserve that flexibility at the higher education level, but for public schools, just to make it easier, 7 through 12, they'll have the national hotline.
Okay, so they'll have the national rather than the local. So that was the only change?
Yes.
Okay. All right. Sounds good.
Thank you. Seeing no further comment, the bill has been moved and seconded. Thank you, Mr. Gabriel. And these are important provisions we're going to add to the student IDs. I'm very supportive of them. I just hope that next year we don't have 10 more of these bills so that the numbers become almost immaterial and not even referenceable on a student ID, which is only that big. So I hope you'll be my champion next year to help me push back when I get 10 bills that people want to add numbers onto the student ID. These are important. Yeah, I'm with you. But who knows what they want to add next. So with that, the motion is you have agreed to the amendments. The motion is due pass to higher education. There's been a motion and a second. Please close.
I look forward to working arm in arm with you on that. I think these are numbers that we selected because they can have significant long-term implications on a student's physical or mental well-being. I think this is a good place to draw the line. Would respectfully ask for your aye vote.
Thank you. Please call the roll.
The motion is due pass to higher education with amendments to be taken in higher education. O'Donnell?
Aye.
O'Donnell, aye. Kylie? No. Kylie, no. Kalra? Kalra, aye. McCarty? Smith? Smith, aye. Weber?
Aye.
Weber, aye.
The bill has 4 votes. It is out.
Thank you very much.